morning, welcome to your manual handling training. I'm Jenny Murphy, the manual handling trainer for SASH, and today we're going to talk about this piece of equipment. You may hear this referred to as a rotastand, a rotaturner, a turn aid, but at the end of the day, what it does is that it helps your patients who can stand up unaided or with very little assistance to rotate, to sit onto another commode or toilet or something like that. So it's important to know that this is not going to transport your patients across the ward. All it's going to do is rotate from one position to another. So it's important that when you're setting up your room, there are two members of staff involved, and therefore one of the members of staff will bring the commode into the correct position. So as with all of our equipment, it's important that you check that your patient is within the safe working load. And on this part of the Rotastand, you will see that the safe working load for this piece of equipment is 200 kilograms, as it is with most of our equipment. So before we start using it, it's important that we make sure that it's clean and that it rotates freely on the stand. You'll see that you can adjust the height of the Rotastand, but you can't adjust the knee plate height. So it's really important again that we give our patients very clear commands as what we want to do. And again, it's important that you check the risk assessment to make sure that this is a correct piece of equipment for use with our patient, which we've done. So we're going to bring in the piece of equipment to our patient, Molly. And what we do is that we get Molly to put her feet on the blue foot plate with her knees up against the knee plate. And then I can put my foot on the front to stop Molly from pushing it away with her feet, if that's what ends up happening. And now what you do is that you slide out this yellow bar on the Rotastand, and then you can release the foot brake here. So we ask Molly to lean forward and to take hold of the Rotastand here. And then when she's ready, what she does is that she brings herself up to a standing position. So I'll use the commands ready, steady, stand, and on stand, I want you to stand. Okay. The purpose of the sliding out bar is that it counterbalances your patient weight. Because if you were a really small member of staff and you were working with a really large patient, it would be quite difficult for you to actually counterbalance the weight. However, one of the types of Rotastand that we have at SASH doesn't have this counterbalance. So in that case, you would have to counterbalance the patient's weight by putting your foot on the front of it. So now we're ready to go. So we'll go on ready, steady, stand. And our patient brings themselves up to a standing position. Now I bring back in the yellow part here, and then I'm going to rotate this out of the way. So my colleague here is going to make sure the chair is far enough away that we're not going to catch it on our patient as we rotate. And as we turn our patient on the Rotastand, she's going to bring in the commode behind the patient. So we ensure that our patient is keeping hold and is maintaining a good standing balance. And then Priscilla is going to bring in our commode. So it's important that you allow the patient to feel the commode or the chair behind them so that they know that it's actually there, because there's nothing worse than sitting down and feeling like you're going to sit down onto absolutely nothing. So again, we push out that counterbalance and we inform our patient that they can sit down when they're ready. Ready, steady, sit. And once we ensure that they're safe and comfortable in the chair, then we would remove the Rotastand away from them. Thank you.